We've all been there. One moment, you're fine. The next, you're running to the bathroom every few minutes. Yep, we're talking about diarrhea. It's uncomfortable, sometimes embarrassing, but most importantly, it can be dangerous if not managed properly. A lot of things can cause it, from viruses to food sensitivities, and knowing how to deal with it can make all the difference. That's why I'm here to break it all down for you. No more suffering in silence. So, let's break it down. What is diarrhea? What causes it? And how can we manage it at home? Or when should we go to the hospital? Diarrhea is when you pass loose or watery stools at least 3 times a day. Sounds simple, right? But it's more than just a mild inconvenience. If left untreated, diarrhea can lead to dehydration, which can be serious, especially for children and the elderly. You see, when you have diarrhea, your body loses fluids and electrolytes, essential minerals like sodium and potassium that keep your body functioning correctly. Dehydration can sneak up on you, leading to weakness, dizziness, and even more serious complications. That's why it's so important to understand diarrhea, know how to manage it, and recognize when it's time to seek medical help. Not all diarrhea is the same. It can be categorized into 3 types based on duration. Acute diarrhea lasts up to 14 days. Persistent diarrhea lasts between 14 and 30 days. Chronic diarrhea lasts more than a month. Acute diarrhea is the most common type. Persistent or chronic diarrhea needs further investigation. Don't just try to tough it out. If it lasts more than a few weeks, see a doctor. So what actually causes diarrhea? It's like a traffic jam in your gut. The main culprits include infections, viruses, bacteria, or parasites, food intolerances like lactose, medications, some antibiotics and antacids, digestive disorders like IBS and IBD. Figuring out the cause is key to treatment. Let's talk about managing diarrhea at home. Stay hydrated, drink lots of fluids. Water, herbal teas, and ORS are essential. ORS contain vital electrolytes. Eat a brat diet, bananas, rice, applesauce, and toast. Avoid dairy and greasy foods, and rest to recover. While most cases of diarrhea go away on their own, sometimes it can be dangerous. Here's when you should see a doctor: severe dehydration, extreme thirst, dry mouth, dizziness, or very little urination. If you notice any of these signs, especially in children or the elderly, don't wait. Seek medical attention immediately. High fever or bloody stools. This could mean a bacterial infection that needs treatment with antibiotics. Diarrhea lasting more than 2 days in adults or 24 hours in children, especially if they look weak or dehydrated. It's always better to err on the side of caution and get checked out by a medical professional. If diarrhea gets severe, a hospital visit might be necessary. Don't worry, it's not as scary as it sounds. At the hospital, doctors can provide IV fluids to quickly rehydrate you and replenish those lost electrolytes. It's like a fast track back to feeling better. Medications, like antibiotics if there's an infection, or anti-parasitic drugs, depending on what's causing your diarrhea. And of course, monitoring doctors will check your hydration and electrolyte levels to make sure you're on the road to recovery. Remember, hospitals are equipped to handle even the most severe cases of diarrhea, so you're in good hands. Alright, now that we've covered the serious stuff, let's talk prevention. Because let's be real, nobody wants to deal with diarrhea if they can avoid it. To prevent diarrhea, follow these tips. Wash your hands regularly, especially before eating or preparing food. This one seems simple, but it makes a world of difference. Avoid drinking untreated water, especially when traveling to areas with different sanitation standards. Be cautious with street food and unpasteurized dairy products. These can harbor bacteria that can lead to diarrhea. And lastly, keep your kitchen and utensils clean. Remember, a little hygiene goes a long way in preventing those unwanted bathroom trips. So there you have it, guys, diarrhea demystified. We've covered the causes, symptoms, home remedies, and when to seek professional help. Remember, it's super common and usually nothing to worry about, but knowing how to manage it can save you a lot of discomfort. Stay hydrated, listen to your body, and don't hesitate to reach out to your doctor if something doesn't feel right. And as always, if you enjoyed this video, give it a thumbs up. Subscribe to Mandana's channel for more awesome health tips, and I'll see you in the next one.